Assalamu alaikum. How are you guys? I hope you all guys will be fit and fine. So today I'm your host, myself Asad Ali, and I'm from fourth year DPD student, and I'm here on behalf of the MPO who is running by Dr. Shaukat Ali. So today our topic is emergency physio department. Okay, how to use physiotherapy in emergency department, and for that I would like to call Dr. Binish, and to introduce herself I would like to share something that she is an assistant professor in SIPMR, and she's also working in clinical settings of ICUs. She have more than 5 years experience about this, and she have also more than 5 years experience in teaching and in as well as cardiopulmonary plus in emergency physio department therapies. So please welcome Ambarish.
Assalamu alaikum everyone. I'm Dr. Binish Adeel. I'm working as an assistant professor at Sun Institute of Physical Medicine and Rehabilitation, Karachi. First of all, thank you MPO team for inviting me for today's session. Today we are gathered here to talk about the role of physical therapist in emergency department or emergency room. First of all, we would like to talk about the background or the idea where it has come from, why there is a need of physical therapist in the emergency room, because by the name emergency room everyone would be thinking it that this is a place where there is an emergency, and obviously because of which a patient or a person would going to suffer from something which is an event and for which he needs to have some critical care. But sometimes, according to Australian triage system, we have categories, and according to which people or the population who are coming to us in the emergency room can be divided into these categories. So, the first category is the most critical patient who needs immediate attention and immediate treatment, and then those who needs immediate attention, but those are not very critically ill, that it is not a life-threatening condition. So then the third categories come where the patient who are not at the life-threatening condition, but yes, they have been through some event where they need some emergency help. So physical therapists can work and share the burden of physician as a physician extender role. So this idea basically, comes from the overburdened population area of emergency room, where physical therapists can work and help as physicians to work there as a physician extender person or a physician extender role. Why? Because the emergency department internationally and also nationally are overburdened. So by overburden, I mean to say that, as I've told you right now, that population who are coming to no. So internationally and nationally, we have impact of burden on the emergency room, where the physician can get less time to cope up with all the patients. So by a physical therapist who can stand and help the physician by looking after these kind of patient who are not in a life-threatening condition, he can serve as a primary care provider, primary care health provider, and he can also give his best to help the patient without making him wait. So over the past few decades, rising health costs, physician shortages have made healthcare transformation a priority. So you see, these transformations are really important in the development of the healthcare practitioner and physical therapist work as a healthcare provider. So I was talking about the primary care healthcare provider. So this is again another wide topic which we can talk about later. Just come to our topic, today's topic. So yes, role of physical therapy in the emergency department. This is a very critical area where you can talk about, and physical therapists can work in the emergency room by providing the direct access and the direct care to the patient. The primary responsibility of the physiotherapist in the emergency room is the mobility and function assessment, right? So obviously you all know that physical therapists are the movement expert. So their prime concern and the prime area of the assessment of the patients is mobility and function. But why the patient can be get how the patient can get benefit actually. So patient can get benefit by physical therapy services, and by helping it they can actually reduce the costs of the patient burden, and they can increase up to a lot of level of patient's satisfaction, and they can reduce the patient's readmissions chances by physical therapist education and their subsequent physical therapist visits and the follow-ups. So the main purpose of the assessment of a physical therapist is to determine how effective a treatment plan can be with the patient, and how to discharge the patient. Because before discharging the patient, you need to carry on, and you need to realize that, is my patient really okay to get all his things done independently, and what does he know, actually does he know how to get care of himself for the acute problem he has came with, and what further plan he needs to be followed. You see, when a patient comes to you as a primary healthcare provider, what do you think you can do? You can, you know that either you can treat the patient immediately, or you can treat and refer the patient, or you need to only refer a patient. So, for example, like a patient, if you're coming to you in the emergency room and he has some swelling after some, let's say, injury to his foot or knee, you are going to assess for his mobility and function, and you can directly come up with the conclusion that this patient needs to be treated for what, and does he need any kind of the referral, for example, referral to a radiograph, or referral to another health expert or a specialist. So you can actually draw these all things within your own expertise by reducing the burden of the patient, by reducing the physician's burden, and you can also help it by reducing the cost, because obviously he is going to wait for long hours in a queue to get his own turn, because if he is not in a condition of a life-threatening condition, so obviously he is going to get the chance after the physician has attended a person who is in a life-threatening condition. So because of which the patient gets really he gets really psychologically disturbed, and he gets really unsatisfied because of its long waiting hours. बेशक वो life threatening condition में he would not be in the life threatening condition, but he would be needing attention, he would be needing immediate care. So this wait time and this satisfaction physical therapist can provide by working as a physician extender role. So as I'm telling you, the purpose of the assessment, he can do the discharge, properly discharge from the emergency department by telling him the plan of his own, and either does he need a referral or treatment and referral also. And he can also do the observation, treatment, reassessment prior to the discharge. Yes, before the discharge, reassessment is also very necessary, because either does he you need to make sure that the patient who has come with you with some acute problem, uski wo problem resolve ho gayi ya nahi, and does he need any further plan or further changes in his treatment before he is going to get discharged. And obviously by reassessment you can also draw the patient attention, and when does he needs to come again for a follow-up. And obviously certain times you can also reduce his readmissions. Just in case like asthma and COPD patients, where you can guide the patient properly, so you can actually going to reduce his visits to a hospital by making him educate, and making him by giving the rehabilitation of his aerobic conditioning. By improving his aerobic conditioning, you can actually improve his aerobic capacity. So this was again another topic, we do not need to get into it. And yes, transfer to respite care, placement or home with additional support services. So this is also important, as I told you कि admission से पहले वो discharge से पहले वो ये देखना चाहेंगे कि does he know his own plan, and where is he going to get transferred, either to some medical care facility or his own home where he needs some additional support area, like अगर वो घर जा रहा है तो घर पे उसकी सारी उसकी मेडिकल केयर की सारी चीज़ें उसकी फराहम है या नहीं है, उसको चाहिए वो सारा फिजियोथेरेपिस्ट प्लान मेक श्योर कर सकता है. The question arises that which is your target population? This is a very important question. So as I've already highlighted that the population who's not in a life-threatening condition, you can entertain them, but also which kind of the population. So by which kind of the population I mean to say the frail elderly. The frail elderly means the elderly patient who is not been in so much of their medical problems, but yet because of their health, their age, they have been deconditioned with various problems, degenerative joint diseases, let's say, or in a general body degenerative changes they have come across. So उनके लिए आप बहुत ज़्यादा टाइम कंज्यूम कर सकते हैं, उनके बैलेंस के इश्यूज, उनके जो भी उनकी एजुकेशन हो सकती है, and then again we can talk about in further next few minutes. And the next population who has been which I have come across by my literature searches and the guidelines says that 25% of all the emergency department visits are because of their MSK injuries. So musculoskeletal injuries, it's the mainstream of physical therapist. So why not he can give the primary care to the patient, and in the emergency room, if the patient needs for example a price protocol, or he needs a referral to a radiograph expert or orthopedic surgeon, so you can actually refer, you can actually treat and refer. So or if he does not need any kind of referral, you can give a plan to a patient for a RISE protocol, and then you can guide for physical therapy and all physical therapy services. So what other treatment or what other services a physical therapist can provide? Screening for falls and providing a comprehensive fall risk assessment. This can be with the frail elderly patients, and also the people who are involved in a neuromuscular problem. Screening for assessing the deconditioning of the patients who can be in an osteoporotic condition by giving them a comprehensive plan, because the latest research says that by exercising regularly you can improve and you can decrease the osteoclast cells activity, and you can help them strengthen the bone and the muscles. So you can also help the elderly people in their osteoporosis advanced disease. You can minimize the osteoporosis advanced disease actually. And obviously again after the MSK you have a population who are involved in the cardiopulmonary problems. You can always entertain these kind of the patients by giving their primary care and doing their assessment, and again treat and referral. You are very expert at managing the pain. You have a lot of expertise in managing the pain and the acute pain, and you can also reduce the use of the painkillers, the NSAIDs, and you can also provide the integumentary system assessments. Yes, this is a very important part now. You can determine the need for assistive devices or any kind of the other adapted equipments which a physical therapist can actually can determine it by assessment. By assessment properly, बेशक वो elderly patient हो या neuromuscular problem के साथ हो या किसी MSK injury के साथ हो, you after assessment of your balance and your different kind of the problems, you can actually identify and you can determine that does your patient need any kind of the adaptive devices or the assistive devices, and this can actually help in reducing your risk of fall. So when the patient is at the risk of fall and he doesn't know that either he needs to have these kind of support system, so by physical therapist you can actually provide them this education. And obviously then your vital signs you can help in the patient, and vertigo. Yeah, a lot of time patients are facing vertigo, the different kind of the vestibular problems, where the patient doesn't know actually that he can be treated with some kind of the vestibular maneuvers, and he can be then and there he can get benefit from this, all excluding pain and headaches and positional vertigo. So this is what a physical therapist can done in minutes. The vestibular rehab is also a very important area, and a lot of time who is not aware about what is the vestibular problem or dysfunctioning and the symptoms of which are associated with it, they are actually not aware of it. So there the physical therapist can identify and help in intervening their own maneuvers, and patient can get benefit in minutes. So as I've already told you that there is a lot of patient satisfaction when physical therapist helps them in providing the primary health care. So I can now elaborate what is the idea behind this, how patient can get satisfied and how physical therapist can actually satisfy them. Because whenever there is a soft tissue injury, and because physical therapist is an expert by treating their soft tissue injury, so by attending the patient by a physical therapist, he can get the proper treatment and assessment, and he can actually get prompt treatment. And by doing this, the patient would not be need to wait a lot of extra time, because physician would be obviously prioritizing patient who is ill, critically ill, and who is in a life-threatening condition. So physical therapists can also, by their expertise and their knowledge, they can help decrease the length of stay in the emergency department, and this wait time is already bad for a patient when he is actually having an acute pain or acute injury. So by decreasing the length of stay, the physical therapist can actually help in satisfying the patient. So in primary care, the patient satisfaction is very important. So and also this musculoskeletal injuries and soft tissue injuries would be needing, obviously can lead to a disability. It can lead to a disability because physical therapists, they have a proper knowledge, but what kind of the injury or what kind of soft tissue injury can lead to what kind of disability, what biomechanics could be get altered because of this kind of the injury, any ligamental or any tendon involvement. The patient can lead to what kind of the muscle weakness or what kind of muscle tightness. So this all time frame of patient only a physical therapist can identify, and only a physical therapist can give a future plan to a patient, and also minimizing their visits by educating them and by giving them a home plan. So actually and eventually the physical therapist is going to reduce the disability of the patient with this kind of the acute MSK injury. As you all know, the acute MSK injuries would not going to soon end, because in near future, they're going to get their biomechanics altered. They can do any kind of the muscle weakness. So actually, the disability is a very important outcome which physical therapist is going to reduce actually. Okay, so the other thing which we need to talk about is the impact on the healthcare cost. Physiotherapy services in the emergency department for the management of the MSK injuries results in clinically equivalent outcomes when compared to a physician, or equivalent or less cost. The literature shows physiotherapist provides high standard care in the emergency department at an affordable cost. Access to the physiotherapist in the emergency department results in early intervention. This early intervention is very important. and it can decrease the future use of the healthcare services, obviously, because as I told you अभी इससे पहले वाली मैंने आपको जो बात बताई थी कि physical therapist, when he can judge actually what a patient with his MSK injury or soft tissue injury has a problem, and what biomechanism does this patient going to alter, what future muscle needs to be strengthened or needs to be lightened up, or what kind of the exercises he need to do, or what kind of devices does he need to have. So this all planning is within the scope of physical therapist assessment and treatment. So this is going to obviously in return this is going to reduce the healthcare cost of the patient, because he is not going to get revisits, and he can actually get minimum revisits by physical therapist home plans also. So we've talked about this categories of the emergency triage scale already, as I told you, on the basis of the emergency triage scales, which ranges from 1, category 1, which means a life-threatening condition where the patient needs to be treated immediately. Examples of these conditions are cardiac arrest and respiratory arrests. Secondly, second category arises like where the patient has a severe dyspnea, airway risk, cardiac chest pains. Patient who needs to be seen by a physical therapist falls in the categories of 3 and 5. So 3 and 5, that means they can have moderate to severe pain. They can be assessed and treated within 30 minutes of time frame, and they can have a minor limb injury. They can have minor wounds, or they are at very low risk conditions. So these all conditions which a physical therapist can try to treat and attend the patient. So now we are going to just going to read about or read some conclusion of the researches which actually the American Physical Therapy Association has developed, and they have by their own researches they have provided us with a very comprehensive handout, which is going to tell you also. I'm going to provide you this handout as well. This is how you can improve your knowledge, and by looking the studies, the pilot studies, where a lot of studies is including the patient satisfaction results, including the patient's healthcare cost reductions, and so on. We can talk about right now. So this is a screenshot of this also. The page you can see this is the handout by American Physical Therapy Association, and it says that improving outcomes in the ED research on the value of physical therapy. So this is a long list of the researches which I've read already, and just gives him this conclusion पे बात कर रही हूँ. I want you guys also to read and learn what are the areas you can actually work with. So I can just discuss few of the conclusions of a few of these studies, not all of them, and so few of these studies we can just discuss right now. The first one is physical therapy in the emergency department, a new opportunity for collaborative care. So it's a long conclusion, but मैं आपको ये बता दूँ कि इसमें भी सारी वही बातें हैं जो मैं आपसे अभी तक करती रही हूँ. फिजिकल थेरेपिस्ट जो है वो अगेन वही सारी बातें, इसके अंदर हम दूसरी चीज़ों को पढ़ते हैं. The second study says the title is dedicated emergency department physical therapy is associated with reduced imaging, opioid administration, length of stay. It's a prospective observational study. So these three things are really important: reduced imaging, opioid administration, and length of stay. So when the patient needs to face these three, like unnecessary imaging, X-ray imaging, or any kind of radiograph, where you can assess properly and you can see that there is no need of X-ray, the patient just having a swelling or edema, local edema because of some kind of soft tissue injury. So you can you can reduce the cost. And when the patient does not need to have any kind of the opioid administration, you can actually help him or save him from any kind of side effect which he can have by having this administration. So only why? Because you have the alternative of your techniques of pain reductions. And obviously the length of stay, how you can reduce the length of stay we've talked about earlier, that you can give the early treatment and you can attend the patient when the physician is busy with some life-threatening condition patients. So this is likely like this, which I've talked about. So yeah, geriatric acute and post-acute fall prevention intervention in the emergency department. This is again a very important research where the American Physical Therapy Association has interviewed and physical therapist fall risk assessment successfully into the emergency department care routine. So this is why important, because when a physical therapist is the only person who can recognize the patient's post-injury level, he can check the functional impairment, and he can also assess that when the patient needs to get discharged, what is the discharge needs, what is the early need of emergency department visit, and when the physical therapist needs to get to be seen by any kind of specialist. Yes, you can also see this study which says the title is the impact of the primary care contact physiotherapy practitioner role on emergency department care for patients with MSK injuries in South Wales 2022. Yes, this is a very important conclusion you should also, you can see in the screen as well. Patients seen by the primary contact physiotherapists were associated shorter time frames for services compared to the patients seen through usual care processes. Emergency department length of stay was shorter by 108 minutes wait time, to treatment time by 10 minutes, and time to first analgesia by 18 minutes. So you can see this cut down time is very important for a person who is being suffering in a acute pain. So you see, the primary concern of this all role and model is to give the patient, immediate response, immediate care, just to improve the patient satisfaction. You can always see these kind of researches and work with this. And yeah, a very important study right now on the screen. This says Specialized Vestibular Physiotherapy in the Emergency Department, a pilot safety and feasibility 2020. This study says that physical therapists can do the role of managing the peripheral vestibular dysfunction in the emergency department. बहुत सारे आप में शायद स्टूडेंट्स होंगे जिनको भी वेस्टिबुलर डिस्फंक्शन के बारे में इतना नॉलेज नहीं है, but those who are in practice and those who have seen the vestibular dysfunction patients, you must know the excruciating pain they go through, the intolerable pain they go through, and just by applying some beautiful skills, I would say, some comprehensive maneuvers, you can decrease the patient's pain within minutes. So this is something which will relieve a patient not to have to go to the again opioid administration, and again a lot of the frustration of the pain. You can actually save him from all of these things just by applying some maneuvers in minutes, and you can just get them satisfied. So there are a lot of studies again which you can go through this handout by after I'm going to provide you, and just we are going to conclude this all today's topic. We can summarize in some highlight points like physiotherapy in the emergency department improve patients' outcomes, reduced rate of the return visits to the ED, high satisfaction to the physiotherapy services, which because it helps in improving their functions. Inclusion of physiotherapy services in emergency department facilitate referral to other inpatient and outpatient program, improving both efficiency and continuity of the care. An improvement in the continuation of care supports a safe return home and return to the community. This is also very important that the patient can resume to his community as soon as possible. So my recommendation is that hospitals right now should be, and the main organization, the administration who are in the collaboration right now, or the main heads or the administrating levels of the physical therapists should be highlighting this, that the hospital, the emergency department should getting encouragement by publishing and printing the free flyer, and should be provided to publicly in your society so that they can get the education that what a physical therapist can actually do. And this is something which administration level should also be taught and get some education and knowledge, so that we can help in establishing the scope of physical therapists in emergency department socially. So these are my references. Thank you so much for your time, and thank you so much to the MPO team for having me. I would like to do a lot of videos with you together again, and you can feel free to ask any questions if you want. You can drop and you can inbox me as well. So, Allah Hafiz, tada, bye bye. Allah Hafiz.